Are you ready? Here we go.
The number one complaint I hear from our healthcare workers
that they're not paid enough, that the government mandating wages doesn't allow them to bargain fair compensation. But I digress. This is Danny's latest video talking about healthcare and how the UCP is going to make it all better. In her cute little PowerPoint video talking about vortexes. It's a lot.
Moving away from a heavy corporate administrative structure with more local decision making through hospital-based leadership. Soon, each facility will have an empowered leadership team supporting our sites, responsible for hiring, managing resources, and solving problems.
What a novel idea. Why hasn't anybody thought of that before? Oh, wait. We had that before. Because before 2008, Alberta had regional health authorities. The province was broken up into a bunch of different pieces, and each one of those health authorities got to make decisions. Because as Danny points out in her cute little video, what happens in Peace River doesn't happen in Edmonton. But that wasn't good enough for conservative governments. Nay. They found the cost too inflationary because every health authority was doing something just a little bit different. There was a lack in continuity of care, budget issues, leadership for each one of those little authorities. And so to solve that problem, one of Danny's mentors, Ed Stelmach, decided we were going to get rid of all of that and make one big health authority to oversee the entire province. Canada's first, actually. But fast forward 33 years, we're going to forget all of that because the problem couldn't possibly be conservative governments who don't know what the fuck they're doing when it comes to healthcare. And we're going to revert back to what we did 33 years ago. Only this time, according to Danny, each hospital is going to be its own entity. Holy fuck. Now I get it, bureaucracy exists everywhere, and it's a pain in the ass for most people. And nobody was thrilled when they consolidated everything into Alberta Health Services, especially all these people that got severance, large severances. But the point was Alberta Health Services was going to cut costs with salaries, because they would need less. But if healthcare was in the dumpster 33 years ago, so much so that the PCs, God, I never thought I'd miss the PCs, decided that they had to put healthcare in the blender and come up with something to save money, create efficiencies, establish equity in healthcare, and improve the patient experience. Where have we heard that before? The same shit that Danny's talking about now. Because they've never fixed it. They don't know how. And when they don't know how, they create upheaval to make it look like they're actually doing something. But they're not. They're just mixing it all up in a blender again.
Albertans are entrepreneurial by nature, and they expect their public services to run with the same urgency and common sense. In business, you can't afford delay. A grocer doesn't wait months for head office approval to cover a staff member on leave. They hire someone and keep the shelves stocked. A contractor doesn't sit on a broken tool waiting for permission. They replace it and keep building. That's how things work when you trust the people on the ground.
You're a broken tool. I'm not comfortable with you comparing healthcare to a shelf stocker or a contractor. Not that there's anything wrong with either of those jobs. Because hiring somebody to stock shelves holds different requirements than, I don't know, hiring healthcare workers. You're a monster.
The bureaucratic vortex ends here because every hour saved on bureaucracy is an hour gained for patient care.
The volume increase of the music shows intensity. What you fail to understand, Danny, is it doesn't matter if it's big or little. There's going to be bureaucracy because, as you said, there's going to be accountability. And with accountability, there are steps that need to be followed so that people can be accountable to budget, to staffing, all the things. But instead of having one mothership, you're going to have lots of little babies all around the province. There will be no consistency in care because all of the people that you're going to be putting in charge, the hospital leaders, are all going to run their places differently because people are people. They interpret and apply things differently. Again, you're a monster.
Because in Alberta, we don't settle for slow systems. We fix what's broken. We back our frontline workers, and we build a healthcare system that delivers for patients.
You're supposed to fix it in 90 days. 90 days! That's way more than 90 days ago. And you haven't fixed sweet fuck all. You don't back the front line because you mandated wages, meaning you don't think they're worth any more than what you think they should be getting. And you also don't back your front line because now it's going to cost them out of pocket to get vaccinated for COVID. Have you seen what an outbreak looks like? No, you haven't. The crescendo is not making its point.
Please share this video.
You bet your grubby little hands I will. You're not fixing shit. You're just moving the problem around, creating distraction, creating all these different processes, probably so you could fund your private surgical health centers. And then by trying to solve the messes that you guys have made, you think you come out on top. Again, fucking monster.